My name is Kathy Ellis. I'm the Director of Health and Wellness for Granite Group Benefits. I am an active member of the Healthy You team and support well-being benefits, health plans, everything kind of from behind the scenes. But what I'm super excited about as far as our topic today is that I'm actually a human performance specialist. That's what my background is. I used to teach up at Plymouth State in the exercise physiology department, and I've been studying movement for almost 20 years. It's something I'm very passionate about as far as a therapeutic aspect of medicine that is very powerful and can truly make a huge difference in the quality of our lives. So I'm also a yoga instructor. So as we talk about flexibility and just movement patterns, I think it's just so important to find a way to make this a priority in your life, especially if you find yourself sitting for long periods of time or having your well-being negatively affected by screens. So we're going to talk about that as far as posture and just kind of what our bodies are being put through on a regular basis. So hopefully, if I can get my computer to wake up, we're going to first talk about the human body and the typical functional movement patterns that our bodies are meant to do. And for us to reflect on how often do we actually put our bodies through those movements. And sometimes if we, have not been as physically active as we've been in the past, our posture, our form, and the efficiencies of our brain muscular connections might be affected in a way that might lead to an increased risk for injury or discomfort. We'll talk about biomechanics, again, those causes of pain that might not be related to any type of acute injury. It might just be how our body is just positioned during rest and during physical activity, and then talk about kind of the takeaways as far as how often you should try to do specific movements to increase flexibility. I have a list of 10 exercises that we'll post a link for towards the end of the presentation that you can explore and see if any of those are helpful and help you feel better. So first and foremost, humans are meant to move. Our whole nature and biological success has been on the fact that we've been able to fight or flight, that stress reaction back in the caveman days when we either were fighting off predators, moving around and hunting for food. But our body is meant to walk, run, and sprint. Our body is meant to squat and lunge and push and pull and all these listed movement patterns. So if you've ever heard of the term functional fitness or functional exercises, basically a functional exercise is anything that mimics that typical human movement pattern. So I hear a lot, especially as a personal trainer in the past, where I'd meet a client and they'd say they had knee pain or back pain, like, oh, I can't do lunges, or, my body doesn't feel good doing this. And, that is a valid feeling, especially we all know our bodies best. But sometimes if we can just practice, very kind of basic movement patterns and lay out the frameworks of creating, again, those brain muscular connections that can help us feel more confident in movement, we can start to activate the right muscles, and all of a sudden we might be able to find the right form and the right muscles that we need to activate so that lunge or that squat can happen without pain. Because think about all the things that we're doing. We're constantly squatting, we're constantly lunging and picking things up off the floor, carrying groceries in, carrying our luggage, and just all different types of movements. But typically when we see acute injury, it's because our body really isn't efficient in some of these patterns and can put us, at risk for discomfort. Understanding that framework, when we talk about low back pain specifically, we're going to talk a lot about the lower body and how it ultimately has a lot to do with what's going on down there that affects the pain that we sometimes might feel in our low back. But going further into form and body mechanics, most back pain is actually not caused by, some trauma or specific injury, but it's because of something mechanical. So whether it's posture that we're stuck in, for a long period of time and muscles kind of turned off or deactivated because they're not being used in an active way. So our muscles start to shorten. So then if we do, the phone rings, we're sitting in our seat and we twist the wrong way and we pick something up with a little bit of weight and torque, we might set off a whole cascade of pain points that might set our back being thrown out, might be something that might make you want to call urgent care or the ER. We'll talk about that more in a second. But mechanics are so important. It can affect your performance. It can, again, decrease your risk for injury. And if we can solve the mechanical issues, sometimes we can reduce the pain altogether, and again, create a road to success as far as just trying to be more efficient with your body movements. So you're not alone if you feel low back pain. Now, I don't want to get too personal, but I have been dealing with low back pain specifically for the last 3 months. I just had my second child. I was nursing. I'm picking up a 35-pound toddler in all different weird positions. So for any of the moms that are listening, yes, low back pain is something that you're dealing with on a regular basis. And sometimes, no matter many stretches you do and how much exercise you do, you're going to experience that. But for others that might be listening, you might just be sitting at a desk or being on the phone for long periods of time, maybe not moving as much as you possibly wish you could, and you might be feeling tightness and negative barking back in that low back area. So 1.2 million Americans every year get diagnosed with low back pain, but many of us are just living with it and not, doing anything about it because sometimes we feel like we can't, or it's just something we have to live with. But what I want to just say as a hopeful statement is that most back pain is preventable. And most back pain, we can make great gains in limiting the back pain once we can identify when our posture might be off or identify when we might be putting ourselves at risk from muscular imbalance, so that we can make a few small changes and just be more in tuned and aware of our body position throughout the day to help any back pain. But not all back pain is preventable. So here's just my disclaimer page, if you will. If your back pain is severe and it's not changing, like if that severity is not changing within a few days, definitely call your doctor. It's definitely something that you want to follow up on. Usually within 72 hours, if you change something, that pain should dissipate even just a small bit. You should be able to tell a difference. Also, if something's more neurological, so if you're feeling tingling, numbness, loss of strength, all of a sudden an arm or limb somewhere in your body, like you lose strength and you feel weak all of a sudden. If you have had a trauma, so if you had acute injury where you've been in a car accident or you've fallen down on ice, in the wintertime, or you have anything that, systems in your body that aren't working, whether it's digestive or, going to the bathroom, just different areas where things are not explained. It might be related to a back injury that your doctor definitely needs to intervene with. But if we're talking about just chronic, tightness and back pain on a regular day-to-day basis, these, again, bullets might be something that you might find yourself here if you are under a lot of stress, a lot of muscle tension, if you aren't as physically active as you want to be or have been in the past, if you've lost weight, if you've gained weight, if your body has changed in any way, that muscular balance might be off. And we're going to talk about how that can create pain. Improper lifting, bending, reaching, how you sleep can matter as far as muscular imbalances. So if your mattress is sagging in the middle, I've been there, done that, as far as why don't I wake up and my back hurts? It's because I don't have the right support all night. Same with if you wear high heels or you go for a long walk or run or hike on a pair of sneakers that have lost their arch support or just need to be replaced. That can set your back off for days. So a lot of different things can put you at risk for muscular imbalances. And I just want you all to ask, how do screens affect your back and your posture? Whether it's looking down in our cervical area of our neck and our top of our back, that you might be feeling tension and headaches and migraines or just, pain. You might feel it if you're, again, we might be on our computer a lot. So the chest muscles might have been getting shorter, and again, creating that muscular imbalance with our upper back. And you might feel tension between your shoulder blades or pain back there. Most commonly, low back pain in that lumbar area, the arch of your back, is going to be affected by sitting for long periods of time when our hip flexors and our hamstrings become short and weak, and our glutes are not activated and they get weak. All of a sudden, everything starts to compensate. And usually the small muscles in your low back, that lumbar area, are the ones that can start to make some noise and again, feel pain in that area. So if this is the case, you might be experiencing the anterior pelvic tilt. So again, I kind of just mentioned it in layman's terms. This is just what a picture of that is. So basically your pelvis is such a root point of so many large muscle groups, and basically that area connects your spine to your lower limbs. So if your hip flexors, which are responsible for you like lifting your legs, and a lot of weight and a long lever happens when you're lifting, even bringing your knees up to your chest or kicking your leg out in front of you. Those small muscles have a lot of responsibility, but they ultimately connect in that posterior side of your spine. So as those muscles are stressed, the tension that you feel and the pain you might feel might be in your low back, but it might be something that's happening in the front of your body. So it's very interesting. When those hip flexors and hamstrings are tight, we tend to have that kind of anterior to the front tilt of the pelvis, which then again puts you in this disposition for long periods of time. And when you stand up, and if you're stiff and you're not getting that regular blood flow to those muscles because we've just been sitting and inactive, if you're not drinking a lot of water, there's not a lot of oxygen and a lot of just in and out of blood flow to that area, that you can stand up and have just that shot of pain or that achiness just all the time. But it's typically caused by an anterior pelvic tilt. Hip flexors, again, have so much responsibility. They are small muscle groups. We're going to talk about the psoas. So if you guys ever said to your friends, like, oh, my tight psoas muscle, it's very common. Again, for those that have desk jobs, but also we were talking earlier about runners or hikers or folks that, are doing distance and a lot of work in that lower body. That iliopsoas is that, again, muscle group that connects the low back into the hip area and the hip girdle where your femur attaches. And again, that thing gets tight, you're going to feel pain, from the front to the back. But sometimes people just think, oh, I hurt my back. It's like, no, it's actually just a mechanical muscular imbalance that you're feeling in your legs. So what's great about that is that we can try to do intentional exercises to lengthen these muscles, lengthening the hip flexors and lengthening the hamstrings. But let's talk more about just stretching in general. So I talked a little bit there about blood flow and drinking water and making sure that if there is any injury or soft tissue issues from a strain or a sprain, if you will, of a muscle, that it's really important that we get blood flow to that area to help pump out, whether it's lactic acid and the byproducts of just, at a molecular level that's happening when energy is exchanged, when our muscles are contracting, but also just, if you think of an old elastic band that you find in your junk drawer, if you just take that really dry old elastic and stretch it, it can fray on the sides. I'm not saying that's what happens to our muscles, but it can be. If that muscle's cold, if you've been physically inactive for a long period of time, even if you're just day to day, you're not very active, but then if you've just been sitting for like 3 hours, you don't want to jump right into a really deep stretch. If you've heard of warming up and you've heard of trying to increase heat to an area, if you think about what happens to particles when they heat up, they expand. And I think so much with back pain, your initial reaction is like, oh, back pain, injury, I'm going to sit, I'm going to rest. I can't exercise, I can't move, I can't do that movement because it hurts. Where sometimes if we can switch that thinking, again, if we haven't had an acute trauma, we haven't had any specific reason why that back pain should be happening, we can try to do some gentle stretching or some gentle flexibility specific training to help extend those muscles, warm those muscles, bring oxygen and circulation and heat to the area of the body, and then the body can kind of almost rewire itself and create those efficiencies that we can rely on for the longer term. And if you're doing that on a regular basis, you're increasing the range of motion of that joint and hopefully starting to alleviate some of that tension and back pain that you've been feeling. Someone had mentioned earlier too, as stretching on a regular basis, sometimes your posture just naturally improves and you like grow an inch or two, and all of a sudden you're just standing up tall and you're confident and just feeling just smooth and efficient in movement because you feel almost connected to your body again. And for those of us that maybe were really active in our past lives and then get away from it because of life demands and then get back to it, it's amazing how much coordination you can get back just by going through regular movements and stretches and even just being aware of how your hamstrings are feeling when you reach for your toes, or twisting even, and this is graphic, but like twisting when you're going to the bathroom and feeling really smooth in that movement and not feeling anything stick or tight, can truly make all the difference as far as just well-being and how you're feeling in your physical body. And can also stretching, regular movement, whether it's yoga, any way that you're working in this style of training, can promote a lot of relaxation and ease mental tension as well. Let's talk about stretching. Dynamic stretching. You're going to see on my handout that you're going to see at the end with the exercise on it that we, again, never want to just jump into a static stretch where you're just holding a deep stretch for X amount of seconds. Dynamic stretching is when you can move a body part through the natural range of motion. And again, create the heat, get the blood flow into that area first, so that again, you're expanding those particles and preparing that muscle to be stretched. This can help decrease discomfort. It can help decrease the risk of injury. So what I like to try to get people to do is functional movements in a shallow, maybe not the full range of motion way, to get that body part prepared for the stretch. So as we're talking about the iliopsoas region, your glutes and your hamstrings, body weight squats. So literally just kind of hovering above your chair, standing up during the workday and just doing some very shallow squats just to, again, awaken that region of your body. Swinging your legs back and forth. That's going to be pictured on the handout. Even shallow walking lunges. Again, not a deep lunge, especially if you have knee pain, are not so confident in doing a lunge. Holding on to your desk, holding on to something, and then wakening up those hip flexors, the front top of your thigh, can get that body part prepared to be stretched. Can train balance, can train, again, all those tiny muscles that support core and coordination. It might be uncomfortable at first. And again, it might not be because the muscle's even weak. It might just because you're not so confident in that coordination and that movement. But as you continue to repeat that movement, it's going to become more familiar and it's not going to hurt as much or be as weird or uncomfortable. So once we've done a few movements, those dynamic stretching movements, where you're, again, moving through that natural range of motion, you feel a little bit of heat, maybe feeling a little burn going in there, then it's safe to do a static stretch. And this is truly the most common form of stretching. It can be almost like a passive experience where you can get your body in a position and sit there and hold that stretch and breathe and allow your body to relax, allow muscle spindles and all the different physiological things that are happening within that muscle to, again, formally relax and expand and stretch. And that's where you truly will get those gains in range of motion. Typically, if you're a beginner, even holding it just for 10 seconds might be a good goal. And as you continue to do it more and more, you'll get more comfortable. You can work up to 30 seconds. We actually see the most gains in flexibility if you can hold your static stretches from 30 to 60 seconds. And then you're going to repeat that same exercise 2 or 3 times to get started. And again, get in a groove with doing this on a regular basis. So I've spoken specifically on specific training to increase flexibility. But if we're just talking about back pain in general, one of the most amazing things I've ever told my clients or people I've worked with for back pain is walking. Moderate cardiovascular activity does so many things for our body and for our mind and for our heart and our soul. But just, again, getting the blood flowing through the body. If you're tight and you're feeling stiff and sore from sitting for long periods of time, just getting up and walking around, increase relaxation. It's going to increase range of motion naturally, kind of can fill those muscles up with blood, filling them up with oxygen and nutrients, and that exchange of the byproducts in our muscular contractions can pump out a lot of the bad stuff and increase the good stuff. So doing that 150 minutes per week is the recommended guidelines. You can break that up into 10-minute bouts a couple times per day. It comes out to about 30 minutes a day. But we want to do that most days of the week. And then adding in specific strength and flexibility exercises at least 2 times per week. So again, that's where that recommendation comes from. For me, I say, if you could pick 2 days where you're putting on your calendar to do these some stretching exercises, flexibility work, you're going to see the effects of that. Or you can kind of maybe work in daily, just picking a few stretches that you're just going to allow yourself to do every single day. You might even see some more gains. But start slow, start with short stretches, especially if you haven't done anything in a while. If you've never really focused on flexibility, you want to start slow. gradually increase. If you are experiencing a lot of low back pain, definitely avoid high impact activities. If you do have low back pain, you can definitely start doing, walking activities, whether it's light hiking when you're not carrying a huge heavy pack. I'm trying to think of some of the other exercises I might be doing right now. Swimming obviously is a wonderful exercise that's low impact. That'll just get your whole body moving. But again, those moderate, low impact activities are what you want to engage in first. And then if you, again, the pain's not going away or it's getting worse, the severity's not changing, definitely follow up with your doctor. If you've never done exercise or you're going to change the intensity of exercise, you always want to just reach out to your primary care physician to make sure that that's safe for you to do. And they might give you some more specific guidelines if you have anything else going on with your physical health. So specific to our recommendations for flexibility training, like I mentioned, always warm up first. Start with those dynamic movements like the shallow body squats, some leg swings, some lunges, again, just walking around the house or maybe going up and down the stairs if you have stairs, access to stairs, and then start to build in that static hold, 10 to 30 seconds to start, and then as you get better and more comfortable, increase that as you go. Repeat each exercise 2 to 3 times, and we're gonna work that in at least twice a week, and daily is most effective. So we are just about out of time. I want to open it up for questions. But I love this quote: movement is medicine for creating change in a person's physical, emotional, and mental state. I firmly believe that and know that if you can be specific and intentional with your movement, you can help feel better on so many dimensions of your well-being. And specifically for back pain, our gut might tell us not to move, but it truly is the most effective way to manage back pain, to reduce it, and hopefully then gain flexibility so you can prevent it in the future. So I'm going to stop talking. Alicia, is there